The government is adamant the new school year will not see the nationwide closures of the last. And as priorities go, the Chief Medical Officer says it's the right one because children are at very low risk of getting seriously ill.
They're not zero, but they're incredibly small. The chances of many children being damaged by not going to school are incredibly clear, and therefore the balance of risk is very strongly in favour of children actually going to school, because many more are likely to be harmed by not going than harmed by going, even during this pandemic.
To address the concerns some parents and teachers still have, the chief medical officers from all parts of the UK have published a joint statement setting out what they believe will be the wider impact of reopening. In it, they say teachers are at no more risk than the general working age population in most workplaces, and that transmission between staff is more likely than from pupils to teachers. The statement also accepts schools returning will likely put upward pressure on transmission in the community, but says that will likely be an indirect effect of more people returning to work and increased use of public transport.
We are going to bring households together who would not otherwise have been together. Some of it directly, some of it indirectly through, for example, allowing people to go to work. And the result of that is it will create some upward pressure on the R. It may increase it. We have still got a really serious challenge of coronavirus for at least the next 9 months. And going into winter, we're going to have real problems with this virus.
That is what's worrying the head teachers union, who want schools to reopen, but believe the government needs to be clearer on its plan B.
If there is the need for a local lockdown, like we've seen in Germany this week, like we saw in Scotland the first week of schools opening, we need to learn from those examples of who do we communicate with, how do we do it, how do we make sure we can reassure as many people as possible.
In the London borough of Newham, an area particularly badly hit in the first wave of COVID-19, most people we spoke to accepted the need to see schools reopen.
Do you think it's the right time, given the pandemic and coronavirus?
Yeah, I think it's the right time.
Yeah?
Yeah, definitely. I mean, children have been off for such a long time.
I prefer to see the pubs closed and the schools open.
I work in a hospital, I'm a nurse, so its virus has actually gone down. So people are scared, and I can understand that fact, but the children are the future.
Certainties have been few and far between over the course of this pandemic, but when it comes to the issue of schooling, the UK's chief medical officers are in no doubt. They say the certainty of the damage done to children by not being at school outweighs any potential risks of getting them back into the classroom.
But balancing risks is different from eliminating them, and while that's the case, reassurances can only go so far. Tom Rayner, Sky News, Westminster.